Assalamualaikum and very good morning to all of you. I hope that you guys are in the pinks of health. My name is Nur Raudhah Binti Jefri. Regarding my assignment for ELC590, I am required to do persuasive speech, and eventually I choose music therapy as my topic for the assignment.
I thought I was dying. It felt like I was having a heart attack. I ended up in the ER to make sure I wasn't.
I got tunnel vision, and I couldn't breathe. I felt like I would pass out for sure.
Now I'm scared every day. What if it happens again?
We talk about the importance of a good life, but what about a good death?
So what did you have for breakfast, Mum?
1 in 3 people over the age of 65 will die with dementia, helping to ensure that wherever possible, the dying person's dignity and wishes are respected.
Susan, there you are. I was coming to find you. Are you all right? I think she even knows who I am now.
What is music therapy? Do you guys like to listen to music, and why? Does music help you with your struggle? Did you know that music therapy is one of the most effective ways for anxiety and dementia sufferer? It is the clinical and evidence-based use of music intervention to accomplish individual goals such as reducing stress, improving mood, and self-expression. Furthermore, music therapy experience may include listening, singing, playing instruments, or composing music, but musical skills or talents are not required to participate. Besides, there is tons of benefits of music therapy such as increased motivation, manage pain, and boost levels of happiness in someone. Everyone, regardless of their background, age, and culture, can freely respond to music as well as music therapy. It is not only for anxiety and depression, but also suitable for varieties of disorder, including Alzheimer's disease, autism, and substance abuse. Do you think music therapy can help people with chronic pain such as cancer? The answer is yes, because music therapy can help decrease pain, anxiety, fatigue, and depression. Besides, soldiers and veterans also could seek help from therapists to cope with their trauma using music therapies that can help them to feel at ease. While individuals with Alzheimer's disease may have regained some memory and stimulate mind due to the predictability, familiarity, and feelings of security with the music therapy. Why the percentage of anxiety and depression disorder increasing among students? It's turned out to be 75% of struggling students who are unwilling to seek for help may have the risk to face harmful outcomes like dropping out of college, poor academic performance, suicide, and substance abuse. This is because a few factors that pressure students to succeed, but they are not fully equipped with necessary life skills such as social life skills. Here are some situational factors that could trigger anxiety and depression among college students, including relationship breakup, sexual assault, peer relationship difficulties, family histories of depression, stressful life events, comparisons of academic, and fear of disappointing parents due to the grades or career path choices. Our level of self-esteem is determined by how much we have been accepted or rejected before in the social world, while our self-esteem is developed based on our experience on how we view people react to us. Thus, students with a lot of acceptance will have higher self-esteem rather than students who experience more rejection. Self-esteem is associated with anxiety, depression, and academic stress, which significantly affects student quality of life and linked to suicide. A social interaction is an event occurs between two or more individuals that occurs every day that result in exchanging information in the interaction. Social anxiety presents as an intense fear of social interaction and make it hard for you to make friends as well as maintaining close relationships besides unable to express yourself with others. You would rather keep your problem to yourself rather than talk to others since the social anxiety is the barrier. The risk of suffering from poor academic performance and resistance to do anything is the symptoms of having anxiety and depression. It is included lack of engagement in the class, poor relationship with classmate and lecturer, besides disinterest in pursuing passion and planning for the future. Thus, student academic performance will be highly affected by this mental health problem because the fear will envelop your desire to try something new. Dementia has significant social and economic implications in terms of direct medical and social care costs and the cost of informal care. In 2019, the estimated total global society cost of dementia was $1.3 trillion, and these costs are expected to surpass $2.3 trillion by 2030, as both of the number of people living with dementia and care costs increase. In 2019, informal care, which is family members and friends, spend on average 5 hours per day providing care for people living with dementia. This can be overwhelming. Physical, emotional, and financial pressure can cause great stress to families and carers, and support is required from the health, social, financial, and legal system. 50% of the global cost of dementia is attributed to informal care. Globally, dementia has a disproportionate impact on women. 65% of total deaths due to dementia are women, and disability-adjusted life years due to dementia are roughly 60% higher in women than in men. Additionally, women provide the majority of informal care for people living with dementia, accounting for 70% of carer hours. Try to reach out for help such as from therapists. As for anxiety and depression disorder sufferer, you could attend the group therapy as it will help you with your social anxiety. But if it's too fast for you, you could ask your therapist for other ways to help you. For instance, meet with music therapists. Music can help you to trigger pleasure since music helps boost feel-good chemicals in your brain. Our brain releases dopamine, which is neurotransmitter associated with reward and motivation. Besides, music also can take your nervous system down a bit via your hormones, but it also can help you ease stress by influencing your biological process. As an example, the tempo of the music can automatically slow down or speed up your heart rate, blood pressure, and breathing. Listen to slow music, which is 60 to 80 BPM, if you are anxious. The tempo will help you moderate your body functioning to low down your nervous state. As for dementia, research suggests that listening or singing can provide emotional and behavioral benefits for people with Alzheimer's disease and other types of dementia. Musical memories are often preserved in Alzheimer's disease because key brain areas linked to musical memories are relatively undamaged by the disease. The types of music which work best for dementia patients is individualized music or songs that resonate and have a personal meaning to them. In a review of several studies on music and Alzheimer's, therapists found that personalized music provides the best outcome in improving moods, reducing agitation, and more. With the technology nowadays, we can listen to music whenever and wherever we want. There are a few apps available in Play Store such as Therapy, Listening, Flow Music Therapy, and Sound Mind Music Therapy. With this app in your smartphone, you can listen to it if you are having an episode of anxiety attack and try to calm yourself down. Music can distract you from your anxiety attack due to the music cognition that is so complex for the human brain. It offers an easy distraction or diversion from any competing internal or external stress stimuli. more than 500 senior living communities and counting use a relatively new musical app, SingFit Prime, to engage their residents via popular tunes. It has more than 400 pre-programmed songs along with a lyric prompting feature that says the lyric right before they are sung to encourage participation. SingFit Prime also features music trivia for cognitive stimulation as well as movement and visual cue for leaders to demonstrate. Senior living communities that use the app include Sunrise Senior Living, Edge Senior Living, and 5-Star Senior Living. Music affects you in many ways. However, it primarily affects your brain through which the rest of your body can be affected. Music is an excellent therapeutic tool for the brain because it activates so many parts of it. It also has been proven that music has a huge effect on your mood. This occurs because of the rhythm and tones that we hear and we listen to music. When we listen to rhythm, our heart actually begins to sing with it. Tones are extremely important since music composed in major key usually sound happier while music composed in minor key sounds sadder. Thus, this ancient art is also one of the most powerful forms of healing for many different sicknesses.